North Dakota is a beautiful land, a lot of green fields, a lot of farming, a lot of busy work in the summer.
We are very rural. We are very beautiful, though. There's a lot of rich farmland, and of course, our winters can be challenging.
The weather can change. You could have sunny, warm, beautiful in the morning and 50-mile-an-hour winds, snowing, and a blizzard in the afternoon. So you have to be prepared to make changes quickly.
So Altru Health serves a large geographic swath in the upper Midwest, in northern Minnesota and northern North Dakota. We serve over 18 counties in our primary market survey. In that wide area that we serve, it is not uncommon for patients to travel 150 miles one way for them to receive their care. So access for us to the telehealth technology and programs, we're just super grateful for our patients to receive that care.
Telehealth actually started out of necessity in 2007. We launched it to support dialysis patients in our rural Devil's Lake clinic. We didn't have enough nephrologists across the region, and specialists were traveling long distances to see patients. Telemedicine made it possible for them to complete required weekly visits while still covering multiple rural clinics and hospital care.
So when a lot of folks think about telehealth, they think about sitting at their home at their kitchen table with their computer. Our system is a little different, where we're more of a hybrid system, where we are bringing those patients into the clinic, still giving them that one-on-one care that they require, but giving it to them in a different way that provides them with the chance to save time, save money, save all that extra travel to go see that provider close to home.
From a provider's perspective, it's definitely increased the number of patients that I would otherwise see, because most of these patients, would not travel down here. So we've been able to see people and provide care who would have been lost, especially at discharge from the hospital. Otherwise, they wouldn't come down here. Hi, Misty. My name is Comfort. I get to see you today, okay?
Hi, Comfort. This is Amy, the nurse. I have Misty here for a follow-up.
So any changes since we last saw you?
No changes.
Okay, so we're gonna start off by taking a listen to your heart. So the technology is pretty similar to if it was an inpatient visit. We do have the stethoscope, so we're able to take a listen to the patient's heart and lungs. Same thing like if they were present. All right, now we are going to take a look at your legs. We're able to look at, if the patient has swelling or edema, if they just had a procedure, and we need to look at the site to make sure it's healing well. We have cameras available to be able to look at that site to make sure there are no concerns for infection. And we could also look at the ears or the mouth if they have any concerns. So from a provider's perspective, and this has been able to reduce our readmission rates, because then if we don't see them, if they're not able to travel down here for the follow-ups, they just end up right back in the hospital. So I've seen, as far as just improvement in the overall care for the patients when we do utilize telemedicine.
Yeah, I think what success is less travel time for patients, better quality outcomes for patients, and keeping patients at the center of our journey to get better with them. Ongoing investment in the technology is really key. We've been early adopters to technology at Altru. I think that's allowed our provider team, our care team, our coordinator team to continue to work and innovate and change and bring our patient population along with it.
As we expanded, we realized quickly that if every site was doing telehealth a little bit differently, it just wouldn't scale well. So we worked on standardizing the equipment. The video platform was the same that we used across sites, the workflows, and even how the visits were scheduled. We created clear processes so staff felt comfortable introducing telemedicine to patients.
In terms of troubleshooting issues when it comes to telehealth, we have several systems in place. We have on-site IT, which is provided at our regional site. We have our telehealth team, and then we have our online or our help desk.
Our equipment manuals now reflect real workflow. They include instructions and quick tips and tricks for common issues. The goal, of course, is quick resolution without disrupting the clinic flow. So our partnership with the American Heart Association Center for Telehealth Learning Collaborative has been incredibly valuable. Through grant opportunities, they've supported and established telehealth programs like ours while also creating space for shared learning. We've been able to grow our own services and also contribute to what we've learned to other AHA affiliated programs. So being part of the collaboration allows us to learn from others, ask questions openly, and share what's working in real world rural setting.
A lot of our patients are very grateful that telehealth is an option, because without telehealth, I don't think they'll be able to make it. I've had days where 50% of my patients, I see them through telemedicine, especially in the winter, because there's no way they'll be able to drive, through the snow and the storms to get here, from 3 hours away. So they're very grateful that telemedicine is an option to still be able to receive care.